Hello, my name is Artur Valerievich and I teach anatomy. And today we're gonna discuss system of vena porta, intersystemic anastomoses, and fetus circulation. And we will start with vena porta. So, as you may know, all blood from this non-paired, mostly organs of digestive system, is drained into the vena porta. Then all this blood go through Hepar, and only then it will disembark to vena cava inferior. So, vena porta. Portal vein, it's big, like wide vessel. It's short but wide. That originated, as you can see, behind the head of pancreas, and it have roots. It originated from unite of vena splenica, from splenic vein, and vena mesenterica superior. It go up inside ligamentum hepatoduodenale. Go in this ligament until the porta hepatis. There it divide onto like branches, left and right, and enters Hepar. At last, it gathers into the few vena hepatiца, 2, 3, or 4, that is fall into the vena cava inferior. It's your previous topic. Now you know that all blood from almost all your organs of digestive system, it's go through Hepar at first, and only then it's drained into the vena cava inferior. Portal vein have a few tributaries. So first of all, it's vena cystica. Here you can see it's vein that drain blood from your vesica. Second and third, it's two gastric veins, vena gastrica dextra and vena gastrica sinistra, that are laying on a small curve on curvatura ventriculum minor, accompany the same arteries, and fall into vena porta. Also pay attention that left gastric vein, vena gastrica sinistra, have one more tributary, that is vena esophagealis. Esophageal veins that drain blood from abdominal part of esophagus. Next, like variant, this vein can drain into the right gastric vein or directly to vena porta. It's vena prepylorica. Prepyloric vein, here it is, or it have a ponemical name, vein of Mayo. You know, it was William Mayo, American surgeon. He opened its clinic in Minnesota, the most famous clinic in America. One more veins that drain blood from the head of pancreas and superior part of duodenum. And the last one, it's vena paraumbilicalis. Paraumbilical veins, they also have the eponymical name, vein of Sapei. Vena paraumbilicalis, there can be two of them, right and left, or even more, it's very. That is, you can see they go along ligamentum teres hepatis, the round ligament of Hepar, from umbilical region, from umbilical ring. So now we go back to the roots of vena porta. It's vena mesenterica superior and vena splenica. So superior mesenteric vein. Vena mesenterica superior, it's, so as you can see, it's accompany the same artery with the same name. It will have tributaries that are the same as branches of arteria mesenterica superior. So first of all, it's vena ilealis and jejunales that will drain blood from your small intestine. Then it's vena ileocolica that drain blood from ileum, cecum, and the appendix. Here is vena appendicularis. Then it's vena colica dextra, right colic vein that drain blood from colon ascendens and flexura coli dextra, and vena colica media, middle colic vein that drain blood from colon transversum. Also, it have few tributaries, as you can see. It's vena pancreatoduodenalis inferioris, anterior and posterior, that drain blood from your head of pancreas and duodenum, and vena gastroamentalis dextra, right gastroamental or gastroepiploic vein, that is laying on great curve, on curvatura ventriculum major, and drain blood from your gastro. So, splenic. or lienal vein, vena splenica. It's, as you can see, it's also accompanies splenic arteries laying behind the pancreas and originated near the porta of spleen, and it have the same tributaries as arteria branches. So vena gastrica brevis, vena gastroamentalis sinistra, left gastroepiploic vein. It have veins of pancreas, vena cauda pancreatis, vena profunda pancreatis, vena magna pancreatis. And the biggest tributary of splenic vein, it's vena mesenterica inferior, inferior mesenteric vein. They also accompany the same artery and have the same tributaries. So the biggest of them is vena rectalis superior. I already told you in previous topic. It's vena sigmoidea from sigmoid column and vena colica sinistra, left colic vein. And in most cases, mesenterica inferior, it's disemboweled to splenic vein. In some cases, can fall into porta directly. As I already told you, you have a few systems of veins. When we speak about veins, you must know that all veins can be divided on tributaries of few systems. We have three main systems of veins. First of all, it's vena cava superior. Second, it's vena cava inferior and vena porta. And in some places, in some organs, we have anastomoses that between veins, that one of them is drained into the system of, for example, vena cava superior, and some of them is drained into the system of vena cava inferior. So we have anastomosis between systems of superior and inferior vena cava. In some places, we have anastomosis between veins of system of vena cava and vena porta. So it will be another intersystemic anastomosis. So we have few intersystemic anastomosis. First of all, you remember plexus vertebralis. Plexus venosus vertebralis internus and externus. All this blood from the spinal cord, spine, muscles, and vertebral column, it's gathered to vena intervertebralis, these intervertebral veins. And where does these intervertebral veins drain into? If you remember cervical region, they drained into the vena vertebralis that are tributary of brachiocephalic vein, it's system of vena cava superior. If you talk about thoracic region, they drained into the vena intercostalis posterioris. It's tributaries of vena azias or hemiazias. It's also system of vena cava superior. But if you talk about lumbar and sacral region, this vena intervertebralis are drained into the lumbar veins or into the lateral sacral veins. It's all tributaries of system of vena cava inferior. So your plexus venosus vertebralis internus and externus is actually big intersystemic anastomosis between vena cava superior and vena cava inferior. Second, you remember vena lumbalis. Vena lumbalis, 4 pairs that drain into cava inferior, and the most upper of them, it is vena lumbalis ascendens that go through diaphragm and became vena azigus or vena hemiazigus, and it's tributary of vena cava superior. But vena lumbalis, that anastomoses with the lumbalis ascendens, it's a tributary of vena cava inferior. So this vena lumbalis ascendens and azigus hemiazigus, it's also anastomose intersystemic between systems of cava superior and cava inferior. And one more, in subcutaneous tissue of your abdominal wall anterior, you have 2 more superficial veins. You remember them also. It's vena epigastrica superficialis that is tributary of vena femoralis. It's a system of vena cava inferior. And vena thoraca epigastrica. Thoracic epigastric vein that fall into the axillary vein, it's system of vena cava superior. So this is third intersystemic anastomosis between cava superior and cava inferior. From abdominal part of esophagus, you have vena esophagealis that fall into gastrica sinistra vein, it's tributary of vena porta. But superior, but a thoracic part and cervical part of esophagus have these veins that drain into azygos, brachiocephalic veins, and also thyroid inferior veins that are tributary of vena cava superior. So this plexus esophagealis, it is intersystemic anastomose between cava superior and vena porta. Then the most interesting, it's plexus rectalis. A rectal plexus that vena rectalis media and vena rectalis inferior is drained into the iliaca interna, its system of vena cava inferior. But superior rectal vein, it's tributary of mesenteric inferior, its system of vena porta. So plexus rectalis, it's also intersystemic anastomose between vena cava inferior and vena porta. And the most interesting and important in this topic, it is on your anterior abdominal wall. There are few veins that create big anastomose, and these veins are tributary of vena cava superior and of vena cava inferior and vena porta. Here you have a big anastomose intersystemic between all three systems. So first of all, vena thoracoepigastrica, followed to axillaris, it's cava superior. Next, in rectus sheath from superior part of musculus rectus abdominis, you remember it's vena epigastrica superior, that is tributary of thoracica interna. Then it follows to brachiocephalic, it's vena cava superior. So here you have in umbilical region 2 veins of vena cava superior system. Then you have vena epigastrica inferior, that's tributary of iliaca externa, its system of vena cava inferior. And epigastrica superficialis fall into femoral, then to iliaca externa, and also its cava inferior. So you have 2 veins also from vena cava inferior system. And finally you have paraumbilical veins, pair or even more, vena paraumbilicalis, that are gather blood from umbilical ring and this region, make anastomose with, as you can see, and inferior and superior epigastric veins and superficial, and drained into the vena porta. So in this region there is this big anastomose. They almost all paired, so you have 5 pairs of veins that are create anastomose between cava superior, cava inferior, and portal systems. And finally, in this topic, we will talk about fetus circulation. The main thing you must remember about fetus circulation is that fetus do not breathe. Their lungs are collapsed, but this developed organism must to get oxygen from somewhere because it need oxygen. So it gets it from placenta. In uterus there will be placenta, like transitory organ that supply oxygen to the fetus. So all blood from fetus come into 2 arteries, 2 arteria umbilicalis, left and right, and its blood come to placenta. It's deoxygenated, pay attention, it's a deoxygenated blood. It came to placenta, here, there it gain oxygen from placenta and became oxygenated and come back to fetus through vena umbilicalis, through unpaired one umbilical vein that enters umbilical ring and go up to the hepar. And here what happens, near the hepar, it, as you can see, divides on like 2 branches. One it's fall directly to vena porta, second one it's fall into vena cava inferior, and this vein called ductus venosus, or it have eponymical name duct of Aranci. All this blood will be mixed already because only in vena umbilicalis it's oxygenated, but when it falls into vena porta, there is venous blood in vena porta, so it mixed with it. And second Aranci duct come to vena cava inferior that already contain venous blood from lower limbs and abdominal cavity. It mixed. Then this blood come to, anyway, it can through hepar or through cava inferior, it to right atrium, atrium dextrum. Next, it's drained into the from right to the left atrium via oval opening, via foramen ovale. You remember in fetus, in interatrial sept, there is opening, foramen ovale, and this it's for this drain of blood. It come to atrium sinistrum, then it come to left ventricle and get to aorta. It come to aorta and first vessels, brachycephalic trunk and common carotid artery. It's the most fresh blood, as you can understand, it come to brain. So now you know that organs that get the most like fresh, the most oxygenated blood, it's heparin and brain. What happens next? Next, blood flow in aorta to lower limbs, to internal organs, but it's already not so fresh. Why? Because it will mixed a few times. First of all, it will be mixed when it gets to right atrium, because into the right atrium also get blood from vena cava superior that deoxygenated, it mixed, and then it get to atrium sinistrum, where some blood also will be mixed. Why? Now we come to right ventricle. I told you that blood from right atrium get to the left atrium, but not all. Some of blood that came from vena cava superior, it can get into right ventricle, then to pulmonary trunk. But again, you remember, lungs don't breathe, and it need no blood there. That's why from truncus pulmonalis, it's blood that get to truncus pulmonalis, to right ventricle, it will be drained into aorta by this duct. It calls ductus arteriosus, or a duct of Batalla. It have eponymical name, duct of Batalla. It's drained into aorta through this ductus arteriosus, and it mixed this already not very oxygenated blood in aorta. It mixed one more time, and actually this blood that came to aorta descendants, most of it is deoxygenated. Then its blood go down to iliac common, so internal iliac, and to arteria umbilicalis, and go to placenta for oxygenation. So that's all. It's a full circle. This fetus circulation. What happens after the birth? After delivery, it starts to breathe. It starts to breathe, pulmonary circle of blood flow on, and there will be some changes in these vessels. First of all, arteria umbilicalis will be closed and became ligamentum umbilicalis medialis. Vena umbilicalis also closed and became ligamentum teres hepatis. This round ligament of Heber, it's actually closed vena umbilicalis. Next, duct of Aransey, ductus venosus, also closed and became ligamentum venosum. Next, also Batalla duct also closed and became ligamentum arteriosum. And all this happens very soon after the birth. It happens in like week. And the last thing is foramen ovale, oval opening. It will closed and became fossa ovale. During the first year of life, it must be closed and became fossa ovale. And now it's all. So thank you for your attention. Ask me some questions, subscribe to my channel, and see you later. Peace.